interestingly, the most commonly viewed topic over the last several months has been compassion fatigue in this particular module. We partnered with this Irish company, Silver Cloud, that delivers computerized cognitive behavioral therapy, and they helped rapidly create modules for us with coping for stress and building resilience. What's interesting is we found that when caregivers went here and chose this and signed up, they actually spent on an average 2 hours and 31 minutes. So there were 4 sessions. People were engaged. They found hopefully some value out of this. And we found that the bounce rates were very low. People, when they went on, they were engaged. We found that tele-spiritual health was one of the most common used resources for people who rated themselves in the mild and moderate range. We found that a lot of parents were concerned about talking to their kids. So there's an internal program that we had put together. And some of this work was happening prior to COVID, but COVID accelerated everything for us. So we have a program called Work to Be Well, which has all kinds of practical tips and toolkits for teens and parents. So talking to your children to help them cope with changes that are resulting from COVID. So many practical things along those lines. Now, one of the most successful parts of this program was the behavioral health concierge, because we realized that even if you had all these resources, people wanted at times to speak with someone. And it was absolutely essential for us to make sure that same-day access to a trained therapist was available. So we created this program called Behavioral Health Concierge, and it's interesting. Most people have got access the same day. We've had 2,945 visits, serving 850 of our caregivers. And a few things that jumped out to me, and there are a lot of stories, but people have consistently rated the high net promoter score, but these are healthcare workers. One would imagine that they're somewhat more sophisticated consumers of healthcare than the rest of the general population, and yet 46% of them consistently said that without this service, they would not have sought help for themselves or would not have known how to seek help for themselves.